You want to make sure that the doctor or the chiropractor that you're seeing is interested in your problem and spends time listening to your concerns, not only in terms of what your needs are, but what your wants are. There are a number of tests that are absolutely essential that be done prior to any chiropractor laying their hands on you. First is a complete and thorough consultation, again to find out what your wants and needs are. Some people want a quick fix and some people want corrective care. Second thing is the examinations performed. First examination, it should always be an orthopedic exam where the doctor assesses and determines whether or not there's any joint restrictions in the body. Second is a neurological exam that tests whether or not the nerve system, the central nervous system, which, as I've indicated before, is the system that brings signals from the brain to all parts of the body, is impeded. Third is muscle testing to determine if there's any muscular needs. And fourth is an X-ray exam. And I believe after the period of time, almost 40 years, 4 decades, that an X-ray is essential. You cannot feel what's going on skeletally without a proper X-ray. Then and only then, the doctor should be or could be or will be prepared to sit down and explain to you 4 things. Number 1, what if anything is structurally and neurologically wrong? 2, you should always be interested as to how it got there. Is it a congenital problem? Is it something you were born with? Or is it something that's developed as a result of strain, injury, or repetitive strain? Third, the significance of the problem. Is it something that is a short-term problem, or is it something that could affect organs in the body? And last, what are the best recommendations that they can give you? Should you be seen on a daily basis? Should you be seen on a weekly basis? Should you be seen on a monthly basis? And to what end? And how frequently retesting should be done in order to determine your progress or lack of. There are 3 levels of care that we offer in this office and really should be offered in every chiropractic setting. Number 1, initial intensive care. Initial intensive care is done or utilized in order to get rid of symptoms, usually pain. Second is reconstructive care. And reconstructive care, much like putting braces on your teeth, is a much longer drawn out program. And when I say a longer drawn out program, it can last from weeks to months. Third level of care that we offer in this office is something called maintenance care. And maintenance care is, as the name implies, to maintain the correction. How long you want to maintain the correction is never up to the doctor, it's always up to the patient. This is the most exciting of all things, to be able to watch patients change from pain-centered to health-centered, to watch patients or to have patients relate to you that this is the first time in years that they haven't taken medication for a problem, or in fact, for the first time in some people for decades that they haven't had pain. And in some instances, people's organ function restoring back to normal. The excitement of that has no boundaries. There's no words to describe that.